Hello people, in this video let us look at the sources of lactate, from where and all lactate is coming into your blood. Okay, and there are so many sources. Okay, and what happens if lactate is more? You will have lactic acidosis. So this person will have metabolic acidosis. Okay, and this person will have tachypnea, that is fast breathing, etc. So they will check what will they check? Arterial blood gas. They will check lactate levels. So you should basically know the sources of lactate, then only you can treat it, right? So basically, let me tell you, let's go back to 12th standard and look at the glucose breakdown. See, glucose breakdown will give you what? Pyruvate. Pyruvate, then if there is oxygen in the mitochondria, what is happening? It is becoming acetyl-CoA and carbon dioxide plus water, right? And it will give a lot of ATPs, energy. But if there's no oxygen, this pyruvate will become lactate via using this enzyme called as lactate dehydrogenase. So basically this is anaerobic metabolism, right? Anaerobic metabolism. So it was leading to lactate production. So this is something that you have already learned, correct? So whenever you have high muscle activity, what will happen if there's less oxygen? This muscle will start producing lactate. Lactate will become, then it will become what? Lactate will cause lactic acidosis, right? So why have we come to this video? To look at the sources of lactate so that we can know who is this cause for lactic acidosis in this patient. So we should know these sources, right? Once we know these sources only, we can treat the patient, correct? So now look at the sources, okay? Infection. Some infection this person has, okay? So this is a non-specific marker actually if lactate is more. So it could be some bacterial meningitis. It could be viral infection also, okay? So it could be a lot of things. And if this infection becomes more strong, what will happen? Sepsis, okay? There also you will have HyperLactatemia, Lactatemia, okay? So then sepsis can next what it can become? Septic shock. There you are measuring the lactate levels again, okay? So what did you learn so far? The sources, normal, you learned that anaerobic metabolism. Then you saw infection, right? Infection, sepsis, septic shock, all this also can lead to more lactate, correct? I think at this point you should know the normal values, okay? 0.6 to 2.4 millimoles per liter, okay? 2.4 millimoles per liter, okay? This is the high value because we are talking about the increased lactate levels only in the blood. So remember 2.4 millimoles per liter is the upper limit that they were talking about. So now let's continue with the causes, okay? The next cause we are going to is shock. Shock, any type of shock, okay? Shock is what? Circulatory failure. The oxygen delivery is less than what the body needs, okay? So it can be many types of shocks are there. In all types of shock, blood lactate can be elevated, okay? Next. Any acute illness, the person can have increased lactate, okay? So acute illness, shock, sepsis, infection, normal anaerobic metabolism, all that you learned. Now let us go to some special things. Tumor lysis leading, tumor lysis, okay? Or a tumor which is going to lyse, that also they are saying, okay? Then liver failure. So basically if you have taken some poison like paracetamol, what will happen? The liver will fail. What will happen if there's liver failure? This lactate clearance from the body will not happen. So lactate will increase in your body, right? That's all. So like paracetamol poisoning, anything that has damaged your liver basically, okay? So when it comes to poisons, basically they are saying, not poisons exactly, toxins. If there's overdose of metformin or you're taking metformin when there's kidney injury, there can be high lactate. If you're taking iron, cyanide, sodium valproate, carbon monoxide, all can, if you're taking toxic doses, poisoned patient, they are saying high lactate, okay? So in these people, they are saying you should check arterial blood gas and lactate, right? If there is reduced bicarbonate or severe liver abnormalities, so it can indicate this, okay, poisoning. Okay, then one more thing they're saying is absolute insulin deficiency. If there is absolute insulin deficiency, high dehydration they are saying, then they are saying lactate can be more, okay? Please look at all this. Metabolic complications of insulin deficiency, okay? So here they have given one table which says all the causes. Let us just summarize by looking at this. Are you ready, people? Good. So look at this. So if there is less oxygen, correct. Shock, again something like a less oxygen only they are saying, I'm thinking. Adrenaline if you have given that patient. So basically in these two cases they are saying beta to adrenoceptor stimulation is happening which will lead to lactate increase. Excess muscle activity, So I'm thinking this is also some kind of this will generate lactate. Then we told you metformin, if you're taking especially metformin with kidney injury, right? Then if you're taking some antiretroviral drugs, okay? Then if there is some vitamin deficiency, thiamine is what? Thiamine is not thiamine. They've not added a E here. Thiamine is what? See, thiamine, both are same only. Vitamin B1 only, okay? You know, if it is THIA, it's that vitamin. Thiamine is actually the vitamin, okay? But if it is THY, then it becomes the nucleotide in the DNA. So just be careful about that, okay? So where were we? Here, right? So excess lactate. Then if there is hepatic failure, that is the liver is not able to clear this lactate, then there will be high lactate. And if there are some enzyme deficiencies also, there can be high lactate, okay? So basically, there are two types of lactic acidosis. One is type 1 and the other is type 2. Wait. See, type 1 is where your body is generating the lactate, okay? So in case of circulatory failure, shock, all this anaerobic metabolism, etc. But type 2 is where you are taking in the lactate, like because of some drugs, it is becoming more. Your body is not making it. The drugs are the cause, toxins are the cause, or if there is liver problem where there's clearance is less, okay, that time it becomes type 2 lactic acidosis. So basically in lactic acidosis basically is a increased anion gap type of metabolic acidosis, okay. Do you know, people, when people say ringer lactate, right, that also has lactate, but they are saying it's a different type of lactate, okay, that you have to research some about it. So let us take some MCQs here. Severe lactic acidosis will happen in which all scenarios? Ingestion of some toxin like antifreeze. When you're using metformin and acute kidney injury, it will cause severe lactic acidosis. When there is some pyruvate decarboxylase deficiencies, that means some enzyme deficiency, or if you're taking adrenaline infusion, there can be severe lactic acidosis. Sulfonylurea overdose will actually cause what? Hypoglycemia actually. Very good. Okay, so this is one MCQ. Let's move on to the second MCQ. So basically here, no need to read this entire thing, okay? Basically, just focus on this one line, which is actually wrong statement. The lactate should be measured, and if greater than 5 millimole per liter, infusion of sodium bicarbonate should be given. What they are saying is no need to give sodium bicarbonate in raised anion gap acidosis like lactic acidosis. No need to give sodium bicarbonate. Now in this video, you have learned the causes. So treat the cause. I think that is what they are trying to say, okay? Then let's go to the third MCQ. So if somebody has normal lactate levels, can you exclude ischemic gut as a diagnosis? They're saying no, because in early stages of ischemic gut, lactate can be normal. So you should not exclude ischemic gut as a diagnosis. This lactate will raise later on when there is liver failure. That's what they're trying to say, okay? So people, in this video, we looked at all the causes of lactate becoming more, okay? Only lactate becoming more. We did not look at the causes of lactic LDH becoming more, because LDH is the enzyme that is converting pyruvate to lactate. That one we didn't look at the causes which are increasing that. We looked at only the lactate becoming more, okay? So we have looked at all the sources of lactate. Let's do one thing. Let's just look up where LDH also is more, okay? Just the names. Like rheumatoid disease, it can be more. Acute renal infarction, it can be more LDH. Anemia, where there's hemolysis. Hemolysis means there will be jaundice also, where unconjugated bilirubin will be more. So in that, LDH will be more. In hypothyroidism, LDH can be more. Then carcinoma of unknown primary, right? Then acute pancreatitis, LDH can be more. In myocardial infarction, LDH can be more. Okay, empyema, lung problems also, LDH can be more, okay? So LDH will help in conversion and making lactate, right?